welcome to this Formations event with Dr. Meg Moorman, whose work I first read when I was doing some research on Frida Kahlo's painting, My Nurse and I, which I'm discussing in my work on breastfeeding, art, literature and culture. And I came across Meg Moorman's research on Frida Kahlo's The Broken Column. Dr. Meg Moorman is a pioneering nurse educator whose innovative integration of the arts into nursing education has significantly influenced the development of clinical judgment and holistic care practices. As a clinical associate professor at Indiana University School of Nursing, she also serves as the coordinator of the MSN in Nursing Education program and directs the Faculty Innovating for Nursing Education Research Centre. Dr. Moorman's contributions have been recognised nationally. In 2022, she was inducted as a fellow into the National League for Nursing's Academy of Nurse Educators as a result of her innovative approaches to nursing education. She's presented her research internationally and consulted with various universities and healthcare workers throughout the world. Her research has led to educators incorporating humanities-based methodologies like visual thinking strategies, which we'll hear about today, to enrich nursing curricula and ultimately enhance patient care outcomes. Today, we have the opportunity to hear Meg Moorman talking about her work and her engagement with several pieces of art. I'm delighted to welcome Meg Moorman, who will talk for a little while before I join her for questions and conversation. Thank you very much for being here, Meg, and welcome.
Thank you, Jenny. I'm so happy to be here. Well, I'm really excited to talk about art and how it transforms healthcare. And I think today when we talk, I'll just briefly go over visual thinking strategies, which is one of the teaching techniques I use. And I'll go over just a few studies that I've done with it, and then I'll give you some examples because I think the very interesting part of this is looking at art and talking about how we might be able to use it in different ways. And I don't think we have all the answers, and sometimes these answers evolve as you have discussions with art. So I'll go ahead and get started. I wanted to just kind of go over, as a teacher, one of the things that we do is we talk about our objectives. And so I'm going to talk about visual thinking strategies, and we will talk about how you can participate in art experiences, and perhaps at another time we can actually have an experience where we have a live discussion with art. I'll talk a little bit about visual thinking strategies, what it is, and how it's been used in the past. And then I'll review some of the science behind this learning strategy and a little bit about the educational philosophy behind it. And then we can talk about ways to consider using art in teaching and art in healthcare, specifically for teaching healthcare workers. So the first thing I wanted to talk about is a little bit about the history of visual thinking strategies. And I think before I actually talk about what it is, I'll tell you how I was introduced to it and just a little bit about my background, because I think that kind of leads into this discussion about how I was introduced to visual thinking strategies. So I became a nurse, and I worked at a hospital in a labor and delivery unit, and that was my biggest passion, was working with mothers and babies. I had a profound experience as a 17-year-old watching a delivery, and I watched the delivery with a friend of mine who was a physician and his nurse, who was also a friend of mine. And when we left the delivery room, I said, I want to change my major from business to nursing. I decided I was going to be a business major. And the nurse said, oh, you're going to be a doctor. That's great. And I said, I don't want to do what he just did. I want to do what you just did in that room. Because she got up with the labor patient. She talked to her directly. She really focused on the patient. She didn't do a lot of the technical things. She really focused on the whole person who was delivering this baby. And it was such a profound experience for me that I switched my major. As a result of that, I went through nursing school and I went straight to work in a labor and delivery unit, and I loved it. One of the doctors that I worked with there asked me if I would come work in her office, and I did that for several years. And I scrubbed with her for all of her surgeries, so I got to know all the gynecologic parts of caring for women as well as the obstetrical viewpoint. And then I became a nurse practitioner, and in the United States, we deliver healthcare. My focus was mainly on doing well care for women, keeping women healthy, talking about different kinds of healthcare options that were more natural, also prescribing. But I loved that too. Then I was asked to teach, and I did not like nursing school when I was a student. And one of my professors said to me, well, if you didn't like it, you're really obligated to go back and make it better. And I couldn't get that out of my head. So I decided to try that. And I've never taught anything except for prenatal classes. So my first day of teaching, I had 140 students in a lecture hall, and I stood in front of them and I did a PowerPoint and I just read off of my slides. It was not a very creative way to teach, and it probably wasn't very effective. But I was very interested in trying to make my experience as a teacher and working with students more meaningful. And I was still seeing patients, and one of my patients said to me, have you ever thought about taking your students to the art museum? And I live in the state of Indiana. The Indianapolis Museum of Art has a program where they do something called visual thinking strategies. And she said, you might look into it. It might be an interesting technique to use with your students. I didn't know what it was. There was a docent at the art museum who was familiar with it. So I had 10 students volunteer to go to the art museum with me. And I saw something happen that I never saw in the classroom. Students who never spoke in the classroom were engaged with a work of art that they had never seen before. They volunteered to give answers. They participated in deep discussions. They really listened to each other, and they listened to the facilitator, and the facilitator listened to them. And I didn't know exactly what was going on. I couldn't quantify it, but I was fascinated by it. And I went back to get my doctorate, and I decided to do my dissertation research in visual thinking strategies. And there was some information about it. So I'll kind of give you the basics about what it is, and then I'll talk a little bit more about how I've used it. So visual thinking strategies was developed by Abigail Housen, who's a developmental psychologist, and Philip Yenowin, who is an art educator at an art museum. And they really wanted to figure out a way to get museum viewers to engage with a work of art. So typically when someone goes to a museum, they've actually studied this, their interaction with the art is about 30 seconds before they move to the next painting. So they developed these 3 questions, and there's a facilitator who is trained in visual thinking strategies. And the first question they ask about the artwork is, what's going on in this painting? And usually in a visual thinking strategies technique, we have about 10 students who engage with a work of art. So someone might answer, I think that this is an apple. And the facilitator will say, tell me what you're seeing that makes you think it's an apple. That requires the viewer to go back and look at the painting again and give visual evidence for what they're seeing. And then the facilitator will make sure that they understand what the viewer saw. So they will reiterate it back and say, so you're saying you think it's an apple because it's round and it's red and there's some shine to it and the shape of it is elongated. And they paraphrase back what the viewer said. That gives the viewer time to clarify and say yes or no, that's not really what I meant. Let me go back and clarify again. Then the next question that the facilitator asks is, what are you seeing that makes you say that, for the visual evidence? And the final question is, what more can we find? Which opens it back up to the group. So with this strategy, we find that people can engage with a work of art from anywhere from 20 to 30 minutes. And oftentimes what you'll see happen is when the facilitator says, what's going on in this painting, no one responds. And if you think about how you learn, a lot of times you don't respond in a classroom because you're afraid you don't have the right answer. You're afraid you're going to be shamed. You're afraid that, oh, I don't know anything about art. My impression is wrong. Let me see what everybody else says, and then I'll decide. All these thoughts are going through our head. But when the facilitator actually actively listens and paraphrases back, and there's no right or wrong answer, you see the group dynamic change, and then people want to participate. They have something to say because there's no right or wrong with art. And your interpretation of it is not wrong. You could be an art history major And your answer is no more correct than someone else's interpretation who's never even seen a work of art in a museum. So one of the key issues with, or the key parts of visual thinking strategies is the role of the facilitator. As the facilitator, and we have training for visual thinking strategies, there is a website called VTS or vtsstrategies.org. The facilitator is trained, and if I'm facilitating a conversation, I have to really be present and listen to what people are saying so that I can paraphrase back. It causes the participants to really quietly look and try to find out as much as they can about the painting before they come up with a response. We ask the 3 questions. You have to listen to understand, so you have to be very, very present and make sure you're really listening to what the participant is saying. You paraphrase the comment back, and you have to remain neutral. You don't say, well, you're right and you're wrong. Everyone's response gets equal attention. And then again, the 3rd question, what more can we find, actually asks the group to persist and keep exploring and looking for more, and see what else we can find without giving any value to what anyone has said, right or wrong, correct or incorrect. The participants, it gives them an opportunity to point out what they see, and then they have to give visual evidence for what they see. And that's really important. We want that in our healthcare workers, because if I'm giving a report to someone about my patient and I say something doesn't seem right, that's not enough. I really need to go further, look further and say, what am I seeing that makes me say that? What's the evidence say? And I have to be more detailed in what I'm saying. It also is really interesting that participants know that they can express what they are thinking in their head, and they want to feel valued and understood. If I could, I would underline and circle this, understood and valued, which is really part of the human condition. That's what we all want, right? We want to feel like people understand and see us and value us and listen to us. And this is really powerful in healthcare. So we'll talk a little bit more about that later. And then the participants have to give evidence and help to explain why they see what they see and what's significant about it. Typically, visual thinking strategies happens in an art museum, and I have taken students, medical nursing students, a variety of healthcare professionals to the art museum. There is something about the place of an art museum that's very conducive to this experience, because an art museum is a neutral area. There's no hierarchy of scrubs or roles or name tags. Everyone's the same. You don't have your degree after your name. It's a first name basis. There's something very safe and calming and neutral about an art museum that I do think facilitates learning. What Abigail Housen found when she did her initial studies, she looked at this teaching strategy in participants who were kindergarten through 5th grade. And she particularly looked at 5th graders in a big study, and she found that repeated exposure or dosing to visual thinking strategies increased communication skills and critical thinking. It helped with social and emotional development in these children. It helped build a sense of community and agency. So they actually got to know other people at the art museum, and they were able to articulate their ideas. So it's a method of facilitation that prioritizes, it's a student-centered learning technique, and you create a community of learners together. And again, there's no hierarchy. I'm not the teacher who's saying, this is what you should get from this painting. I'm strictly, if I'm facilitating the discussion, I'm literally there to facilitate and to help understand, nothing more. I don't have an ulterior motive to teach something that is on the agenda for the day. This is actually based on a learning philosophy by Lev Vygotsky. It's the sociocultural theory of learning. And so he said that learning really is synthesized through social interactions. And he had the zone of proximal development. So learning happens between what a learner can do alone versus with guidance. So there's that scaffolding. So as the teacher, if I can provide some scaffolding and some safety for you and kind of help you to structure your learning, and then I can eventually take that away and you will do the work on your own. So it's support from teachers and peers that help bridge gaps in knowledge. And as a facilitator in a visual thinking strategies environment, I can also help facilitate and bridge some of those conversations. And it's appropriate in nursing if I can link it back to clinical care if the students don't get there on their own. It also is really effective for language and thought development. So this concept of thinking out loud is really important for other learners in a situation, whether it's in a classroom or in a hospital learning environment, really anywhere. If you think out loud and you tell us how you got to that idea, even if it's wrong, it informs the other learners. So actually thinking about it out loud and hearing what your process is can inform me so that I can help to learn that way too. So again, it's based on a strong learning philosophy. And then what we do with social learning theory, we start with a collaborative learning environment in the visual thinking strategies. It's in the art museum where you have the viewers and the facilitator. You get cognitive growth, the scaffolded instruction, which you can actually use in the classroom too. We use a lot of active listening. People learn to express themselves in a way that's meaningful and valued and communicative to others. And then we use clinical reasoning. So all of these things are involved in the social learning theory. So when I did my dissertation and I published it, what I did was I taught students in one semester in an OB or an obstetrics course, and I gave them the opportunity to go to the art museum and do a one episode of visual thinking strategies. And in that 1 hour, we reviewed 3 works of art. And then the next semester, when I was no longer their teacher, I recruited these students for my dissertation. And I did interpretive phenomenology. So I recruited them back. We went to the art museum again and used 3 more works of art. And I did not facilitate these discussions. There was a trained VTS facilitator. And then I interviewed the students and I asked them these questions. What meaning does it have for visual thinking strategies? Why, what about it was meaningful for you? And then how have you, now that you've experienced it last semester, and we did it again this semester, how have you used it in your nursing? And after these in-depth interviews, I came up with 3 themes. One was feeling safe in learning, and this was really powerful. You know, I teach in a classroom with, I taught in a classroom with 140 students in a lecture hall. And when I would ask a question in class, one of the students they said, well, we're afraid to respond. We're embarrassed. You know, if we get the wrong answer, we're shamed. So they felt like being in the art museum was safe. They also felt like because there was no judgment about their response, that they felt safe that way. They really valued hearing what other people thought. And then oftentimes, if someone said, well, I think this is an apple, and the next person said, I think it's a pear, then the third person who responded said, I could see why you would think it's a pear. Now that I look at it again, it does have an oblong shape, or whatever this discussion would be, and they could scaffold off of what someone else said. So they really felt like it was a safe way to explore learning and interpretation. And they could see things from other people's viewpoints. And if I asked them, well, how would you use that in your nursing, or how is this germane to how you might use it as a nurse? Okay, I think we got cut off because I lost my internet connection. I was in the middle of a storm here in the United States, so I had to switch locations. But I wanted to just pick up when I was talking about some of my dissertation findings. So seeing differently was definitely part of what the students noticed, that they were able to see things that they hadn't noticed before because of the other viewers' observations. But one of the most interesting findings that we had was that we came up with what we call facilitative teaching. And so as a teacher, I noticed the way I teach now is different because of visual thinking strategies. So if I ask a student in the classroom, what's going on with this patient, and I don't acknowledge a right or wrong answer, and a student says, well, I think this patient has, for example, hypertensive disorder. if I say, tell me what you're seeing that makes you say that, even if it's the wrong answer, students get a chance to give evidence for what they're seeing, and it helps me to look at my teaching, and I can say, oh, I can see why you say that based on something I said last week in lecture. Let me go back and clarify. That's very different than saying, you're wrong. Who else wants to go now? Who else wants to offer an answer? It changes the dynamic of the classroom. It really models reflective learning and respectful learning in the classroom. So that was a big shift for all of us. And then validating what I hear from students. And even if it's the wrong answer, we have a collaborative learning community there. I can say, well, let's talk about it. Let's look at it from a different angle. Did you see this lab value? And I might point something out, but it's in a mutual way, which again models the way we would like to work in practice. So it's a mutual respect, and it creates a creative learning environment. Next slide. So there's another study that Dr. Klugman did at the University of Texas, and he looked at nursing and medical students, and they had several interactions with visual thinking strategies. They did it for, I believe, 8 weeks every day for at least 2 hours every day in the morning, and then in the afternoon they would have a class. And what they found was that they did a quantitative study. They found that the students who underwent visual thinking strategies had a higher tolerance of ambiguity. And there's actually a tool called the Budner's Tolerance of Ambiguity Scale. And in medicine and in healthcare in general, we live in the gray area. We oftentimes have patients who have headaches of unknown origin or abdominal pain of unknown origin. So it really helps students because there's not always a right answer. When I do this visual thinking strategies with students, oftentimes they'll say, well, who was right? There may not be a right answer. Everyone's interpretations are valued, and that's hard for students to get their head around. So it does increase tolerance of ambiguity. And then they found that students who had undergone VTS also were more willing to communicate, and they used more descriptives when they documented their medical condition, and their ability to diagnose was more correct or more accurate. Next slide. The most recent study I did with visual thinking strategies, and Jenny, I think this is the study that you had seen, we published in the Journal of Holistic Nursing. The article was just published, The Use of Art to Develop Holistic Nursing and Clinical Judgment and Educational Intervention. Next slide. And what we did with this, it was interesting. We had a class with senior nursing students, and we actually did 3 different interventions with them, or we looked at their interpretations of artwork at 3 points in time. So the very first time they came to class, we discussed this work of art. And before we discussed anything, we showed this slide in the classroom, and then we asked the students on their computers, what's going on in this painting, and they typed in their answers, and then we submitted that, and then we did visual thinking strategies with them. So I facilitated a conversation with the students in the classroom, and I said, what's going on in this painting? What are you seeing that makes you say that? What more can we find? A wide variety of answers. And then the third intervention was we actually had a librarian come after they had entered their VTS answers in the computer. We also asked them, how did your interpretation change from your initial viewpoints to after this discussion with visual thinking strategies? The third intervention we did was we had a librarian come and give the historical context of what happened with Frida Kahlo. Next slide. So the timeline was, again, show the artwork with no discussion and have them enter their answers, show the artwork and facilitate a discussion, and then read the historical context of what truly happened with Frida Kahlo. Next slide. So what we found was that when they initially saw the painting, they had a lot of emotions and feeling. They talked about the life and story, what they guessed might be happening with her, which were all very different viewpoints. And then they kind of reported, instead of really interpreting, they just said, it's a woman with straps around her body. She looks like she's in a desert. There was not a lot of insight into it. Next slide. After we did visual thinking strategies, we had a 62% change in their perceptions of what was happening in the painting. So they really noticed a lot of things. There was a lot of informative thinking and group thinking. They noticed things that they hadn't noticed the first time after the visual thinking strategies. And then we came up with this theme of duality of meaning. So some people had referred to or kind of reported that she looked like she was in a desert, but other students said, well, that might have something to do with the fact that she's barren, and they related it to her fertility. Or that she's been injured, and that's a metaphor for what we're seeing in her environment. And so it went from reporting to really more analyzing and interpreting. So there was a pretty big shift there in what they saw. And so one of the quotes that I think was interesting was one of the students said, when other people gave their views and ideas on what they thought was happening in the painting, it opened my eyes to views I didn't glean from my first look at the painting. That's very significant in learning, especially in group learning. And we can model that in healthcare. If we have discussions about artwork, we can see things that other people may have noticed that we didn't. If we do that same kind of dynamic in a group and we go into a room and we're looking at the patient and we're talking with the patient, a social worker is going to see things very differently than the nurse or the physician or the housekeeper who may have noticed something different. So the whole healthcare team really looks at things through different lenses and can inform what's really going on with the patient. Next slide. Then we talked a little bit more about the medical timeline of what happened with Frida Kahlo. And when she was 13, she actually broke her, she was in a car accident and a metal rod perforated her uterus. So she had many miscarriages. She had her broken back. She actually painted that while she was on her back in traction. And we talked about she had over 50 surgeries to repair her back and many, many miscarriages and losses, and she was never able to carry a pregnancy to full term. So to hear that historical timeline of what happened really also changed their image. So again, you kind of get this analogy for going in and just looking at a patient's chart or walking in a room and thinking you know what the patient is really there for, then having a group discussion and being informed of the patient's history, it gives you a more comprehensive or holistic view of what's going on with the patient, which is really significant in healthcare. We need to look at the patient as more than just their diagnosis. They have a whole series of experiences that they bring in to the hospital or the clinic that we need to acknowledge and that can really inform the way that we deliver our care. Next slide. Again, this is just a picture that when we talked about the history, and on the picture on the right, you can see she's actually painting that picture while she's in traction. So it was just amazing. Her drive and her drive to create was so strong and to express. It really informed her paintings. Next slide. So again, we looked at the different stages and we identified emotions and feelings first of all, and then how the life story can inform care and listening to others, how it can inform your perspective. So for students, this is really important that they learn to listen to the patient and their story. It's not just what they see in the chart or what they hear from the healthcare team. It's important to review the history and understand that. So when I work in women's health, it's very important that I understand if a woman has had a history of sexual abuse. That may not be in her chart, but it completely changes the way that I am going to deliver my care to her. So allowing patients a place to reflect and share when they feel safe is important. And then one student said, I can see the loneliness now and her isolation after hearing this story. And that's really important that we understand that, not just with patients. I would say in a bigger perspective, it's important that we do that with each other, right? We're more than just what we look like on the outside or who we encounter in the grocery. We bring all of these things to our experiences, and it's important that we acknowledge that, and we can't just classify people in one category or another. They bring a broad range of experiences. So art gives students the ability to practice this. Next slide. Another work that I did, or a presentation that I did, was presenting with the National Health Service in England. We talked a little bit about creating culture of kindness through visual thinking strategies. And again, with art, we take out any kind of hierarchy, and we become as people who have eyes and have visions and have experiences that we can share. There's no lab coats, no hierarchy. it's really important that we listen to people and listen deeply. It increases the value of our conversations and the experience of our relationships. And we as healthcare workers, it's not always what we do for someone, it's just being present with someone. I remember very distinctly working one night on a night shift as a student nurse, and I had a patient who had come all the way across the country to get a surgery from this particular surgeon. And they opened him up. He had testicular cancer. And when they went to do the surgery, they found his cancer had metastasized everywhere. And they just closed him back up again. And his family had gone home for the night. They'd gone back to their hotel. And I went in to check on him in the middle of the night, and he was wide awake. And he said, "Do you mind just sitting with me for a little bit?" And I didn't know him, but I sat there with him, and we didn't talk. We didn't do anything. I was just with him. It was probably one of the most powerful things I could ever have done as a nurse. So I think as humans, sometimes allowing people space to be with them, not trying to solve their problems, not trying to think about what are you going to say next, but just giving people the gift of your presence, it's really a kindness that we can share with people, and letting people talk and tell their story. Again, mindfulness, having a safe place like an art museum, or in my view, a classroom should be a safe place to explore learning. And it's not just on what we do as healthcare workers, it's listening and being with our patients. Next slide. I'm also interested as an educator in the way that art affects our brain. So there are different kinds of learners, and we can have rote memory. So if I am working with a nurse who works in the emergency department, I could teach that nurse CPR, and I could say, these are the steps of CPR, and you could memorize those, and you could repeat those back to me. But then I could also say, let's actually do CPR. And there's this kinesthetic learning when you do compressions. That activates a different part of the brain. But actually, art can affect the prefrontal cortex, and that's where a lot of storytelling and meaning making takes place. So if I tell someone a story, a nurse, a story about someone who had experienced a heart attack and what it was like for them, now they have 3 ways of accessing that information. So we're laying different neural pathways. So I think that's also important, that art actually can light up a different part of the brain, and you can access that information in a different way that makes the whole experience more meaningful. Next slide. This is a work of art, and I just want to give a few examples that I've worked with. I did this work of art with my students, and this is a massive carving in the Indianapolis Museum of Art. And we would just go in, and students, I'd say, what's going on in this painting? What are you seeing that makes you say that? What more can we find? And there would be a wide variety of answers. But as I've done it over the years, it's amazing the nuances and the subtleties that students pick up on that I've never seen. So if you look closely, there's a larger figure in the middle, and that figure is actually breastfeeding. And so we've had discussions about this is some kind of healer in a community, or some people say it looks like there's smaller figures in a house and there's figures on the outside looking in. I've had students say that there's vessels with white substance in it, and it's probably breast milk, and that can be healing. And they use a lot of metaphor for learning because I teach OB. But one time, one of my and it's called Healing of the Ibuku Children. And when we go to the art museum, I do not cover up the placard. They can go up and read what an art museum educator thinks that the painting is about. And so I assumed that Ibuku was a village in Nigeria, which is where the artist is from. And one of my students was from Nigeria, and she said, "Do you know what Ibuku means?" And I said, "No." She said, "It means a child who's destined to die." And that completely changed my vision of the painting. And then another semester, I had a student who said, "Oh, I took a folklore class. This artist's name is Twin77, and he's from a village in Nigeria. And he was the 7th set of twins that his mother had had, and the only one that survived out of all 14 children. So he came from a village in Nigeria that has the highest rate of twinning in the world, and they've done studies there. So you could use art to teach a concept like maternal morbidity and mortality, or infant morbidity and mortality. That wasn't my aim when I used this. Actually, I never picked this painting. The docent at the art museum picked it. But you could use the art to teach a specific topic. That is not my goal with visual thinking strategies. But it's interesting. One of my students, when I did my dissertation, said, I remembered that painting. We did it the semester I had you for OB. The next semester when you interviewed me for my for your dissertation, I had to go into the ICU or the critical care for the first time, and I was completely overwhelmed. And the first thing I thought of was this painting. Next slide. And he said, I walked into the ICU and I saw this patient on a ventilator with all these pumps. And I felt just like I did when I first saw that other painting. I was overwhelmed. And then I broke it down into small pieces, kind of like we did. I looked at the patient and I said, oh, the patient's been in a car accident. Then I just looked at the IVs. Then I looked at the medications. Then I looked at the ventilator. Then I looked at the drains, and I broke it into small parts. But then I stepped back and I said, the patient's been in a car accident. And while I was doing all this assessment, the physician came in and said, I think we're going to wean the patient off the ventilator, take the patient off the ventilator. And the student turned and looked at the doctor and said, what are you seeing that makes you think she's ready to come off the ventilator? So he actually used the same questioning that we had used in visual thinking strategies to get more information from the doctor, which is a Vygotskian principle of learning where you take formation, reformation. You actually take what you learn in the classroom and you apply it in the clinical setting. So we were really happy to hear that. Next slide. You could also use art to teach different concepts. This is a huge sculpture that's in the art museum, and we've done this with several students, and students say it looks like a poodle, or it looks like an elephant, or it looks like clouds. But I've had several times where students say they recognize there's this pattern recognition that they can articulate. So they actually have said, oh, it looks like a cancer cell that replicates itself, or it looks like venereal warts that replicate itself. And when you say, what are you seeing that makes you say that? They talk about, well, a tumor has irregular borders, and if it's a benign growth, it has smooth borders typically. Next slide. So you could actually use the art to teach concepts like pattern recognition, which happens a lot of times on its own. I don't pick the artwork with a specific topic in mind. The students often will find their own way and bring up what's germane to them. Next slide. This is another really compelling work of art that I use a lot, probably more than any of them. And this is called Scenes from a Tropical Space, and it's by an artist named Titus Kaphar. I highly recommend you go to YouTube and look at his TED Talk. He's a fascinating artist, and he actually cuts out pictures of the babies in his painting, in a lot of his paintings. And that is so significant. So this is called Scenes from a Tropical Space. So we can use this to teach concepts of climate change. We can use it to talk about access to care. We can use it to talk about morbidity and mortality. I had one student say, well, it looks like two women pushing strollers. And I said, when I was facilitating a conversation, what are you seeing that makes you think that these are women? And the student said, oh, that's my bad. I apologize. I shouldn't assume gender. And that was not my goal, was to have a discussion about assuming gender. But that was really important to that student that he say that. He said, I shouldn't assume gender. And I said, well, that's one of my questions for VTS, but no, you shouldn't assume gender just because of the way someone dresses. So we had a conversation about that. That kind of came out of this discussion. It was not an objective or a goal for the conversation. But Titus Kaphar, it's really a compelling way to have great discussions. I did this, I worked with a group from palliative care, and we discussed this painting for over an hour. I actually had to stop the conversation so we could get on with the rest of the program, but it's really meaningful. Next slide. And this is another artist that I'm just starting to use, and I'm not sure if you're familiar with her. It's Katya Kovitz, and she is a Prussian artist, or she's from Russia, and she's a graphic artist who lost her son in 1913 to the war. And so you can feel this mother's pain. And when you talk about that and you know her history, there's so much that you can discuss here. So again, just a really powerful work of art that elicits a lot of conversation, and it allows people to tell their own personal stories too. Next slide. I think that's all. I know I could talk on and on about artwork, but and I apologize that I probably went over a little bit. But yeah, if you have any questions, please let me know. It's visual thinking strategies. It's really an effective way to learn about cultures, about topics, about artwork, and really, again, it's more about the conversations that it opens up and the way that we listen and interact with each other is what I find the most interesting about it.
Well, thank you so much. That's been really fascinating. And I think it's really compelling. You make such a strong case. And not only your case is made in such a compelling way, but your feedback from the nurse participants is so compelling. The article that you referred to includes a lot of their feedback. You brought some of it to the presentation. Um, but it really does show the significant potential of approaching patients following visual thinking strategy that they recognised, and that they recognised its ability to diagnose holistically and to feel more confident in their practice. So I wanted to ask you a little bit more about that. Do you think that you will have the opportunity to gather more data from the nurses who you've trained this way in the future? Or is there any other way that you can think of gathering data to show, to convince people of how effective this is as a strategy?
I think there's a lot of ways. I don't think we've even really tapped into the potential to use art like that.
Mm.
But I think one of the ways I'm interested in, we have a nurse practitioner program, and we have 7 different nurse practitioner programs at Indiana University. We are going to implement a program where we introduce visual thinking strategies in a physical assessment class. So some of the students will get visual thinking strategies and some won't. And we'll look at their ability to diagnose. But also we're looking at that level of noticing subtle nuances. So if someone's going into respiratory distress, we want to catch that early. My supposition is that students who have visual thinking strategies will be able to articulate those subtle nuances before the students who haven't had it. Mm. So what are the things that you're noticing? If you feel, for example, if you feel unsafe or you have what we call intuition that something is going wrong, how do you articulate that? What are you seeing that makes you say that? When you get in that habit of going ahead and actually listing the things that you see or you notice, it helps to quantify and communicate that with other people. So we will put that into a physical assessment class. We'll probably have students write some reflections about what they've noticed, as well as do group discussions and use some rubrics to kind of see about what are they noticing and how many. We'll try to quantify what are the symptoms that they're noticing.
Mm. I can see such potential, as you say. You say it's been untapped as a strategy so far, and obviously my research is on the representation of breastfeeding and thinking about different breastfeeding practices globally, and the way that breastfeeding is discussed by people, and the barriers to breastfeeding that lots of people experience, and also the ways that lots of people are pressured either to breastfeed or not to breastfeed. Of course, breastfeeding support works very differently in the UK from in the US, and there are different standards, norms, and practices throughout the world. But I wonder whether you have any insight into how breastfeeding or lactation support works in the US, and who you perhaps hope might adopt your strategies in lactation support in the US.
Well, I think postpartum in general, we really need to do a better job of listening to patients, to women in particular, and to families. So breastfeeding isn't just a mother, and it's not just a baby. You have 2 people who are trying to learn something. One might be very good at it. You might have a mom who's breastfed 4 other children, and you have a newborn who has some problems or issues with breastfeeding. So you really have to assess that situation and find out. So I use this, it's not exactly breastfeeding, but I used to use this in the postpartum unit with students. They would chart mother and baby bonding well. Well, what does that mean? And when I would push them to say, well, what are you seeing that makes you think that? Tell me what you're seeing. Then they have to look deeper, and then they have to go back and say, okay, well, the mother is looking at the baby and she's talking to the baby and she's cuddling the baby and she raises her voice in an octave that's a little more nurturing. The father is involved with the baby. He's actually sitting by the mother and helping support and getting things for the mother. So that is very different. So when we say that a baby is latching on or poor latching, what are you seeing that makes you say that? And then I think even more importantly than that is the fact that we need to let mothers talk about what are their perceptions of breastfeeding, what are the barriers and facilitators, and how can we help them? Because it may not be a breastfeeding issue. It may be something at home that's going on, or it might be a comfort. Are they in a comfortable chair? I recently had a friend of mine who works with poor families and immigrants, and the mother was having problems breastfeeding. They didn't have a chair for her to sit in. She was either in bed or she was standing. They literally did not own a chair in their home. So we gave them 2 of our chairs because she needs a chair. She doesn't need to always be in bed to breastfeed. So those are the kinds of things, she could have just said, well, how's breastfeeding going? But she really tried to listen to the patient, and there were other things that were going on. So I think that training women or teaching caregivers who are helping mothers try to breastfeed, listening, giving them that space, really trying to understand and listening and being present can really open up a lot, and it will clarify a lot of barriers that might be there.
Yeah. You mentioned in your faculty feature interview, which celebrated your project, about how using art to help nursing students have conversations about things like, I'm quoting from you, diversity and health disparities, has been so supportive and has enabled teachers to help students to talk about difficult topics. And I also found a similar thing when I ran reading group sessions, working with very short stories with a group of at-risk young mothers in an established kind of crafts-based workshop. And the group organizer told me that for the very first time, after they had read short stories and talked about short stories, many of them were able to articulate things like very traumatic birth experiences or their own difficult relationships with their parents, which had informed their parenting practices and made them think about parenting in different ways. And I wondered if you could talk a little bit more about your experience of using art to help students or to help patients to talk about difficult subjects, perhaps things that nursing trainees find uncomfortable or something that's a challenge for them to encounter in diagnosis.
Well, there's a wide variety of ways to do that. One of the first things I thought of when you asked me that, Jenny, was I had a student tell me one time when I interviewed her for my dissertation, this is the first time I feel like anyone's ever really listened to me. That was so powerful. So through art and through visual thinking strategies, we have the ability to really listen and validate what they're saying. And I think that that's an experience that that helps to facilitate conversations and communication. But I also think that going forward, we need to think about it's art is not personal unless you choose to make it personal. So students will oftentimes tell stories about the artwork that relate to them. But if I said to a student, okay, we're going to have a discussion about maternal loss and how mothers lose babies, and I want you to go in and talk to that patient about the fact that she just lost her baby, that's overwhelming, right? But working with a work of art and having a group discussion about this inanimate object, the artwork, this outside external thing, allows us to practice with these conversations before we actually do it with patients. And it's even different than simulation or standardized patients because, again, we're putting students in a high-risk situation where they're being observed and graded. This is a safe way to kind of bridge those gaps and practice some of those conversations. There's no wrong answer with artwork. And so it allows students to kind of build on each other's experiences. You can share your own personal experience if you want to, but you certainly don't have to. And maybe you have an art history degree and you know about Twin 77 and you're able to share some of these other viewpoints, but it's a safe place for everyone to talk about. If they want to talk about, they see breastfeeding in it, they could talk about community, but they can bring what they want to the conversation without any expectations. So I feel like artwork does lend itself. It's this external way. It's a tool, if you will, to have these difficult conversations that lets us kind of ease into the conversations. You can bring as much or as little as you want for your own personal experiences. And I think there's great value in that.
Yeah. I wonder whether you've had any negative responses to this. It feels as though, from an outsider perspective to the kind of medical world, that there's a reason why diagnosis often feels so um, inhumane or clinical, so so disconnected and detached from the individual. So perhaps a reason for that is that medical practitioners are sometimes uncomfortable about making assumptions, and maybe there's a good reason for that. Maybe they might bring in bias. They might introduce bias into the diagnosis if they're acting on things like age, socioeconomic circumstances, gender. We hear lots of stories about women's conditions being misdiagnosed and ignored and considered as sort of standard reproductive health related pain, and underlying conditions being ignored, and perhaps suggesting that bringing in more holistic thinking might be rejected by some people. Have you encountered any resistance to your approach?
I have not encountered resistance for the most part. I mean, I have students, during COVID, we did this a lot online. And it was a way to have interactive discussions without actually being in the same room. And I think a lot of students want to learn their skills. They want to learn how to start an IV and all those things that are very exciting and the drama of it. But so I think I have had students say, I'm not really interested in this. And I've had other faculty members say, we don't have enough time to develop something like this because we really need them to learn the basics. And I totally understand that. But I think in addition to the basics, this is a powerful way to learn. And I don't, I think in healthcare, so much of what we're doing now, and I'm not sure if it's this way in the UK, but it's driven by time. You have to bill a certain amount. And so in order to do that, you have to check boxes. And we have electronic medical records now where you don't even really get to chart what you see. It's already, it automatically puts it into the system for you if you check a box. So it dehumanizes healthcare a little bit. And I think there's a lot of frustration with that. But the act of listening and giving someone, one of the things we talk about in this kindness and care group is one of the first things you can say to patients is, what can I do for you today? And that they may have a lot of problems and medical problems, but what's the one thing we can work on today? And again, that is giving space and listening to patients. And it's instead of student-centered learning, it's patient-centered care, right? And so you can use that and parallel that. And that's hard to teach. And of course, there are people who think this is silly. We don't have time for this. We need quantifiable data. I think we will get some quantifiable data like that Klugman study. We are able to see that it does we can quantify some of these outcomes. And I think we can do that with listening to and observational skills. So there is some resistance, and we have a lot of students who don't want to do it and they think it's silly. But I do have a fair amount of students who come back to me. I teach in the graduate program now, who I've had an undergraduate, and they say, this is a really valuable experience. We have a children's hospital, Riley Children's Hospital, and I heard that they have a nurse residency program, and they were using visual thinking strategies in their residency program for their nurses. So I contacted the person who was in charge of it, the clinical educator, and I said, I'm just curious how you learned about visual thinking strategies because I haven't heard a lot of people use it. And she said, I had you in class 6 years ago. That's when I had 140 students in my lecture, and I didn't remember her. It clearly made an impact on her. And now she's asked me to start working with the residency program. I've had other nursing students come back and tell me, I always think about that when I say, something's not right with this patient. What am I seeing that makes me say that? It's that voice in their head or that questioning. So it's not for everybody. It's not the answer to all of our healthcare needs by any means. And we don't always have time to do it. But I think that it does show in my own relationships. I've noticed I take time to listen and not try to solve problems. And that makes a huge difference. To validate what someone's feeling, it really strengthens relationships. So it's not for everyone and it's not the panacea, but I do think there's a lot that it can do that is helpful.
Perhaps as a final question then to end our conversation, I would love to hear a little bit more about your Harvard Macy's Art Museum-based Health Professions Educational Fellowship, which you've been awarded just recently. I wonder if you could talk a little bit about what you aim to do on the fellowship and maybe perhaps talk about whether you think there's a shift in health professions education, either in the US or globally, that draws on the arts and humanities more than perhaps in previous generations.
There are certainly pockets of people that do that, and Harvard is definitely on the forefront of that. They've used visual thinking strategies. The first way I heard about it was I had read a book called A Whole New Mind by Daniel Pink, and I went to a lecture that he did, and he talked about using art to teach medical students. And I just sent him an email and he responded back right away. I asked for the study and it was using visual thinking strategies. And then I also had a patient who told me about it all about the same time. So Harvard has always been really on the forefront of using arts and humanities. They actually have an art museum on their campus. So they take students to the art museum quite a bit. So the fellowship was something I heard about last year. As my research center was recently dissolved, I thought, well, what can I do next? And someone told me about this fellowship. So my proposal was to introduce visual thinking strategies into our nurse practitioner physical assessment class. And I'm not exactly sure how we're going to materialize this, but I had some thoughts about physical assessment and how we notice those subtle changes. So quantifying that, using tools to look at students who undergo VTS, do they notice, can we quantify those subtle nuances to respiratory distress or even cultural differences? So if someone has a different culture or their food intake is different, how do we elicit that information in a way that's meaningful and quantifiable? So those are the kinds of things I'm hoping to explore. So the program actually will be a year-long program where we'll develop tools and we'll look at assessment of those skills, and then we'll implement it the year after that. So I'm starting it in the fall, and I'm really looking forward to it. I think there's a lot of good ideas in terms of how to quantify it. There's that Budner's tolerance of ambiguity. I did a small study that looked at using more words to describe patient conditions. Can you accurately assess something if you have visual thinking strategies? Are you more likely to get a correct diagnosis? So there's different ways to quantify it, and I think that's what we'll probably do in this course before we actually roll it out for our students year after next in 2026, fall of 2026. So I'm really looking forward to that.
Yeah. Well, it sounds amazing, and I really hope that we have the opportunity to talk again, to talk about that. And I feel like we could have talked for a lot more about all of your work, all of your findings, and we could have talked about much more art together. So I really hope that we have the opportunity to do that at some point in future. But for now, thank you so much for being with us. It's been fascinating to hear about your research, and I think there'll be a lot of people who will watch this and be really convinced and compelled by everything you've talked about today. So thank you so much for being with us.
Thank you so much, Jenny. I appreciate it. It's a lot of fun.